Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello again, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and today, for the second time, sitting down with Dr. Michael Huot, who is the Chief of Staff at Monument Health in Rapid City. From leading hospital teams to handling the unexpected, you are kind of at the center of it all. But what I want to get into with you, Doctor, is what a Chief of Staff really does and what so far has been the most memorable moments for you as you've been doing this, if we can get into it. So welcome back to the show, Doctor. Glad to have you back.
Yeah, thank you. Thank you.
You're absolutely, yeah. I'm excited to get into this conversation because I already kind of know where it's going to lead, but I got to get there. All right. Yeah. And thank you for the chai tea as well.
Yeah,
you're the first one that's ever brought me anything.
I wondered if I was. I was thinking of other people.
Yeah, you're going to be back on here a lot. All right, let's start with the basics, Doctor. What exactly does a chief of staff do at a hospital? Because we hear this all the time. If anybody watches any medical show, you will hear chief of staff. What is your job?
So chief of staff is probably, I think, one of the most important jobs in a hospital. And so it's going to take a little bit of a history lesson to kind of let you know what the medical staff office is and what the chief of staff does. And so prior to 1920, in hospitals, physicians would just go based on state laws. They would go and they would practice based on state laws. So for instance, in South Dakota, Dr. Michael Huot, I'm able to do cardiac surgery. My state licensure says I can practice any form of medicine or surgery. So what stops me from doing cardiac surgery? Because I've never done cardiac surgery before. Other than being an anesthesiologist. Well, prior to 1920, nothing stopped people from doing this. So you would have individuals that would be doing procedures, practicing medicine in a way that maybe they weren't qualified for. And so in 1919, the American College of Surgeons said that every hospital has to have a medical staff office and an organized medical staff. And so what that medical staff does is it's different than like the hospital administration. It's different than the people that run the hospital. Its sole focus is making sure that every provider in that organization can do what they say they can do. And so they're focused on making sure that if you're going to come into our hospital and do brain surgery or cardiac surgery, we have a very extensive process to make sure that you're qualified to do that so you can safely do it in our hospital. So we would never let you step foot in our hospital and do that unless you're qualified to do it. And then once you're in our hospital and you're doing it, our office monitors your safety to make sure that what you said you could do and what we vetted you to do is what you actually can safely do in our hospital. And so it's really crucial for patient safety. You know, a lot of people say, well, you know, my state licensure says I can do this. It's like, this is a whole nother level of protection because the state licensure really is the bottom rung of safety. You know, that's made by a bunch of politicians who really don't know anything about medicine. What we do in the hospital is we have a bunch of medical providers that really set the standard for, are you qualified to do this safely on the people in our community? And so those bylaws and the medical staff office is really what rules the roost when it comes to safety. You know, and even our state law, there's state law as to what I can do as a doctor, but they say that the bylaws of the hospital, the medical staff office, supersedes state law. So if we say you can't do it in our hospital, it doesn't matter what your licensure says, you cannot do it in our hospital. And so this has become it's just such a cornerstone for safety that now JACO, which is an accreditation body, and the CMS, which is Medicaid, Medicare, they require hospitals to have a medical staff office and an organized medical staff to make sure that you're safely doing what you say you can do.
Are there instances, I'm not saying at Monument or with you personally, but are there instances where doctors will argue that and say, like, look, I don't care, I can do this. I'm going to come in, I'm going to do it, whatever. Have you ever heard of stories like that or run into that yourself?
Yes, that actually happens. It's very common. That happens all the time where somebody is coming in and they want to do a certain procedure or they want a certain privilege. And we say, well, no, you haven't done, 50 of those in the last 2 years, say. So you can't do that at our hospital. Now there's processes by which we can make sure somebody does safely do them and gets that procedure. Right. So we can kind of go through and backstep, but it's a much more extensive process if somebody doesn't have the experience that we feel they need. And every medical staff is a little bit different. You know, the bar is going to be set a little bit different in every community based on what that experience is required to do certain procedures.
Do even like small towns that have their own hospital? Do they have Do they have the chief of staffs as well?
Yep.
I mean, or something similar?
Yep. So every hospital that takes Medicare, Medicaid is required to have a medical staff office, an organized medical staff, which would then be led by the chief of staff.
Yep. I'm really curious as to how many people knew what you just said.
I would say most people don't know. In fact, most doctors in residency, when they finish, they don't even know this. Like, there's been doctors that have been practicing for years and they don't fully understand the separation between what administration does and what like the medical staff office and what an organized medical staff does and what our goals are. But it's pretty crucial, it's crucial. Like medical errors is thought to be maybe the third leading cause of death in America. So you have cancer and cardiac disease taking 1 and 2, and then medical errors. That's wild. So the safety of a hospital and reducing medical errors, a huge onus of that comes onto physicians and onto the medical staff. Now, luckily, we have organizations like Leapfrog that come in and evaluate our safety as a hospital. And they can really look at all of our data and say, are you safe? Are you privileging the right people? Are you doing the right procedures? And May 1st, we were rated an A hospital in the country, which only 30% of hospitals in the country are rated an A.
Wow.
The next highest level in South Dakota is a C. So people kind of say, well,
you don't want to say who that is.
This or that. I mean, there's a lot of argument about how important safety is, but for us, it's crucial.
Why would there be an argument about how important safety is? Why would that be a thing?
I just think when people look at these ratings, they kind of wonder, well, is that really true? Oh, did you pay for that rating?
I see.
And we didn't. These are independent rating systems coming in and looking at how safe are you and how do you compare to other hospitals. And, our goal here is, yes, we're rural. We're kind of in the middle of nowhere. The next big hospital is, 300 miles away. But we want the care that you get here to be comparable to what you get like in Denver or a big metropolitan area. And a huge component of that is what I do as chief of staff and what our medical staff office does to really make us just, really, honestly, one of the top hospitals in the country, and certainly the top hospital in safety in South Dakota.
Now, you're a doctor of anesthesiology. Did you set out to make this a goal for you to end up as a chief of staff of a hospital?
So no, I did not set out to. I didn't set out to do that. I wouldn't say. Now, I've always had I would say a very deep-seated passion in helping this community. I grew up in this community. Yeah. My whole family lives here. And when I came back as an anesthesiologist, I actually had 2 offers. One of them I was going to get paid twice as much as the offer I actually took. The offer I took was with the hospital because I wanted to care for our community, and I felt like really having that broad spectrum of care and really caring for people that kind of need you the most, that was really important to me as a doctor.
And you live here. You know these people. I think that's another big part of it. I'm sure there's enough people that you see, though, you've never met before, but you still know, you have a grasp of what these people are going through because you're here, right? And that has to make kind of a big deal.
Oh,
or a big
100%
difference.
It does. Yeah, 100% it does. And I think that's, I think people that really care more about just a paycheck and really are coming to work, even you, and really care about the community and making an impact and making a difference in our community. I think those people are really who shape our community.
Oh,
and
absolutely.
Make us have a fantastic community.
So when you first took this job, was there any big surprises that you weren't ready for?
It was, I guess it was a little interesting just to see operationally how the hospital works. I'm now on the board of directors as part of this job. And so, I know the medicine side and I feel like I know the med staff side. I didn't fully understand the finances side and a lot of other things administratively it takes to make sure to run a hospital in a small area like ours.
Do you have to know a lot of that as chief of staff, or is it just
no? You don't have to know a lot of that. It's just part of being on the hospital board of directors. My role on that is as chief of staff and all the things that I know. But being on that, I've found out a lot of other things that are kind of important. And we have people. And you start to understand, I think, some of these administrators and what their goals are and their impact on on our system, like Paulette Davidson, for instance. I mean, she is just a phenomenal, caring person. I mean, she is fantastic. And she has put together a fantastic team of administrators that have really allowed our hospital, one of her goals is to be here for future generations.
Yes.
When I first started, we were being told that our hospital system could not last in this area because it would have to be absorbed by a bigger hospital system because of the finances. We really struggle in this area just because of our demographics to take care of patients. And so the finances part of it is really tricky. But we're the only ones that offer certain things like the NICU, like neonatal intensive care unit. If your family or friends or mine has a baby that needs that kind of intensive care, a service line like that in Rapid City can lose about $1 million a month. Whoa. And so how do you pay for that? Well, you pay for it by doing lucrative services like a total knee replacement. And so when you come to Monument Health and you have a lucrative service line, you're paying for a service line that wouldn't be here. It wouldn't be in Rapid City if it wasn't for our ability to make money on other service lines and use that money to keep it in our community. Whereas if you have, a lucrative medical service somewhere else, that money goes out of our community. And so these things that Monument shifts money from one service line to another to really help support our community. Mental health's another big one, which I'm pretty passionate about. Right. That's a losing service line, and people maybe don't realize that. And Monument Health funds that by doing things that are lucrative. Now, that's not to say that we expect you should just come to our hospital. Absolutely not. That's not the reason to come to our hospital. And that's why us being a Leapfrog A rating is so important also, because we've also proven that we are the safest hospital in South Dakota through our Leapfrog score and our culture. And so the service lines we're providing you are just fantastic. They're not just fantastic. They also allow us to do services for our community that we really need, that you don't have to drive to Denver to have done.
And that's such a big deal. I mean, for us around here, like you say, we've talked a lot on this podcast specifically about our location and why, like you've said, these certain service lines are so important that you don't have to go 5.5 hours away or 9 hours away to Rochester. Places like that where you might need, there still might be instances, of course, where that has to happen. But here, at least the care starts and it's very well managed, I think.
Yeah, 100%. 100%. And it wasn't always that way, but it is that way now. We've been able to shift our culture to one that is just fantastic. We have everyone from the valet to Paulette Davidson,
right.
Cares about the community and is passionate about what they do. And they're not just collecting a paycheck. And I think that makes a difference. And it really shows in our quality and the kind of care we can deliver.
Do you have a typical day?
I don't really have a typical day. No, as chief of staff, you never know what you're going to get. It could be, every day there's something. Every day something comes up. When you have an organization as large as Monument Health, there's always something that needs to be tackled or something that needs to kind of be addressed on some level, which is kind of fun because you really can make an impact, I think, every single day.
Yeah.
Whether it's mentoring colleagues or helping, certain service lines that need, something. We have meetings 3 times a year where we focus on certain service lines and we talk with community doctors, employed doctors, and we try to think, well, how can we make this better for our community? What services are we lacking? And so just from a really big global scale, it's really cool to try to really help the community, but every day is different. You never know what you're going to tackle.
That has to make it exciting though, too.
Oh, yeah, very exciting. Yeah,
because things aren't typical.
Thinking on your feet all the time.
Well, now, and obviously, the position that you're in and the team that you must have to direct, working in a hospital is a high pressure job. There's no way around it. It's you're up there with firemen and police, and it's every day can be kind of stressful. Do you have to kind of become a moral leader a little bit too? Not moral, but morale leader is the word I was looking for when it comes to this, to keep everybody on task, on target, not burnt out.
Yeah, I think so. One risk, and this is among physicians, but it probably is among every healthcare worker, is we work in a very high stress job.
Yes.
And we're doing that job over and over and over again. And I think sometimes, people maybe forget what that feels like for the patient. It's like, this is my first heart attack. It's like, oh, okay, you're the 5,000th person with a heart attack that's rolled through these doors this year,
Right.
But for the patient and the family, it's like incredibly scary, and so like I think we have to keep reminding, and I do think part of my job as a leader, as chief of staff, is to keep bringing that focus back to our providers to understand what we really do. Like, when you first start medicine, you have a real passion for, wow, this is incredible. Your eyes wide open. I mean, you're just seeing what you're doing and how you're helping people. But by the time you're on your 10,000th case, you're kind of like, oh, okay. Maybe you kind of have to remind yourself of that. And people even help me do that, like my wife. One thing, this was probably 5 years ago, I was on call through the night, and the next morning I told my wife, it's like, oh man, I got paged for 5 epidurals. And she's like, if you don't want to get up in the middle of the night and do epidurals, then quit your job, because that's your job. And I was like, I guess that is my job, and
exactly
so now,
needed to hear.
so now, and I get paged in the middle of the night, I have my own little mental exercise where I think, well, how exciting for these people, that are in labor.
Right.
They're going to have a baby. It changes my perspective.
Boy, that is a good way to think of it.
It's not my 10,000th epidural. It's this person's first epidural, potentially.
Right.
And their brand new baby. And so I go in there. It may be 2 a.m. I'm excited. I'm trying to be engaging, and it's exciting. And those people remember you. They'll come up to you in the grocery store and be like,
"That's the
you did my epidural."
Right.
And it's like, oh, that's cool.
I mean, a very
How's
painful procedure, and they're like, "You did it!" I was so excited.
Got, a 4-year-old in the car. It's like, is this him?
Yeah.
So.
No, what a great attitude to take into this, though.
So I do think being part of a leader is trying to, help everyone feel that way.
Yeah. Are there misconceptions in this job that you've come across, or people that maybe have? Because I can turn a lot of it back to television dramas about, and they're very popular, about hospitals and doctors. And are there misconceptions from those shows that you've ever run into or have so far as being chief of staff?
Well, I don't watch those shows.
Good.
Me and I have 2 siblings that are physicians, and every Tuesday night we try to watch a show with my dad, and we recently started The Pit.
Okay.
After The Pit, we watched the first episode, and 3 of us were like, we're not watching that again. It felt like our whole day of work. That wasn't enjoyable for me.
Exactly. Right.
But I do think that there's misconceptions as to what you can do or what you can accomplish. Like when I first started as an anesthesiologist here 15 years ago, I heard physicians say, quality is administration's problem. This is administration's problem. That is administration's problem. And the reality of it is, the real answer is it's all of our problem. Again, from the valet to the CEO, mm-hmm. It's all of our problem. And if we don't all develop a culture where it's all of our problem, we'll never get better. And people said, oh, Monument Health could never get better. We're always going to be a D hospital. Not true. And so that is a misconception. Me, as being chief of staff, and prior to this I was credentials chair, I've been able to make a huge impact and influence things significantly. And so one person can make a huge impact, and one person can significantly influence the direction of an organization. Now, am I taking credit for all this? Absolutely not. I'm like this little bit of credit, but it's 50 different people in leadership roles, trying the best that they can, mm-hmm. moving the ball this much, that has made us the safest hospital in South Dakota. And it's every caregiver, every person that works there making a difference. And so, if people say, oh, you can't make an impact, you're just one person, it's like, well, give it a try, because you can. And
you said that this isn't you're not in this position now of chief of staff for life. Yep. I mean, this is a very limited amount of time that you have to do this, correct?
Yes, that's right. So it's basically you get voted into a 3-year commitment where you're secretary of the medical staff for a year, you're vice chief for a year, and you're chief of staff for a year. And when I got voted in, I actually, when I remember they called and said, hey, we think you should be the next chief of staff. I was going to say no. And then I said, let me get back to you, because I thought, it's never good to answer a question right away. Yeah. And I just didn't know if I had the time for it, and I didn't know if I had the skill set for it. And, things in life can be scary sometimes to try to make a decision. So I got off the phone, talked about it with my wife for a couple days, and she's like, man, you might never get this opportunity again. So maybe you should try it. So I said yes. But, so that's what it is. It's like, it's a 3-year commitment. You can do anything for 3 years, and it's turned out actually to be fantastic. And I think I've made a really huge impact.
So then what would be, when you're done, when somebody else moves in, then what's next? Do you just go, I mean, I'm not saying just go back to being an anesthesiologist, but I mean, then what happens?
Well, It depends on how involved you still want to be. Like I would like to still be pretty involved in the quality arm. I think we've been able to make like a really huge impact in quality and safety of our hospital. And so I do plan on some level to continue to be involved in that.
I see. So, when you get a chance to meet new doctors, I'm assuming too, that are coming into the hospital and everything, I don't know how many of them walk up to you and be like, Dr. Huot, I would like to sit down and I want you to give me all of your knowledge and advice about being a doctor. But if you could right now with a microphone in front of you, give advice to these new doctors. Because it's what I've been learning throughout this podcast is it is becoming more kind of one of the running themes through this is, and you touched on it a little bit earlier, is being able to spend more time with patients, being able to just listen a little bit more, to where people don't feel like I'm in the doctor for 15 minutes, I didn't get all my questions out, and now I got to move on because he's got to move on or she's got to move on. And it seems to me like this ability to connect is becoming super important. Is that a good something you want to pass on to these new doctors? What's your advice that you give them?
Yeah, I think a couple things. One is to never rush through an appointment and never feel production pressure. I mean, there's definitely production pressure as a physician.
That's a good way to put it.
And I think you have to back away from that and just kind of remember that what your job is. I think you always have to, like I said before a little bit, you always have to also, I think, refocus yourself on like how impactful this is for a person. They're kind of letting you in their sacred space. And I think that there's a tremendous amount of responsibility to be in that sacred space with them, because you'll know things about patients that nobody else knows.
Right.
Maybe even their spouse doesn't know. And how you interact with that patient or it can be so impactful to them. It can be like, just life-changing to them. So I think that's one thing. The second thing is get a hobby. No, you can't just work. You got to do something. Right. Me and my older brother, we cycle. We maybe cycle 4,000 or 5,000 miles a year. And some of my best thinking I do when I'm cycling. People are like, well, how are you on the bike for 4 hours? It's like, I had a lot to think about. So get a hobby. Get some hobby, whether it's,
well, you also
do crocheting or biking or golfing. You got to have some other hobby and because you want to show up for your patients every time and you want to be 100% ready to really help those patients. You have to also kind of take care of yourself in that regard too.
Well, you're also big into this. Perfect. You set this up perfectly.
Layup.
You're also big into yoga with your wife as well. And you do what do you call it?
Yeah, so my wife, she used to own the yoga studio.
Okay.
Which was one of the first yoga studios in town. And she, I think Mary Hensley opened that studio, and she was one of her first teachers in the late 90s. So she owned it for 4 years and loved that. But one thing that came out of that is she started this thing called the Black Hills Yoga Festival, and I kind of helped her, like as the side guy. And what it essentially is the concept of it is just to build community through interactions with other people, movement. And so it's really become such an amazing thing. The last couple of years it's been up at Minor in their amphitheater. Last year there was 400 people doing yoga.
That's amazing.
And then there's always a band afterwards, which is Whippin' Boy, my little brother's band. My little brother just had a baby Billy.
Nice.
And so he's like, I just want to watch this year. So we asked Tom Willock and Toadstool Jamboree if they would play after the yoga festival this year. And as you know, Minor has changed hands, so now it's owned by Cohort. Yep. Jason Kingsbury is like very excited about the yoga festival. So it's the last Sunday in July. You can go online, get your tickets. They're free. But come out. There'll be vendors. There'll be food. There'll be one yoga class, all-level yoga class. I think it's like at 9 or 9:30 out in the amphitheater. And then Toadstool Jamboree will follow. Family-friendly event. Yeah. We encourage whole families to come. It's just a great time for the community just to get together and spend time with each other.
I'm so happy you said 9:30. I was waiting for you to be like, it's at 5:30 in the morning, right when the sun comes up. No. That's when we're out.
Yeah,
now I might be able to actually be there for that one.
Yeah, so you'll have to come.
Kidding.
If you come, I'll give you a free hat and another coffee.
Yes. This is the coffee's been great. Before I let you go, Doctor, there is one more topic I want to cover with you, because I have, I've always been on the other side of this with doctors that have come in, because we have always talked about the danger of social media when it comes to medicine, health, where you get your information from, and how sometimes, I don't even want to say sometimes, I want to say most of the time, that information is just pure BS. So I'm really excited because I finally get to sit down with, let's just call you a TikTok star, Dr. Huot. I'm sitting down with a legit TikTok influencer right now, but somebody that's on the right side of that influence. Somebody that is giving people the information if they ask for it, comments, whatever. Because your TikTok is mostly you and your life, which is fantastic.
Yep, that's right.
It's. I encourage everybody. You're at Michael Huot MD,
yep,
and it's
right.
Huot.
Yep,
right.
Huot. Yep.
Michael Huot MD. You can follow on TikTok. How did all of this come about for you? Were you just watching TikTok and thinking, "Yeah, I can do this. I can do this"?
No. So what happened? Actually, it's a funny story. Several years back, we rented a cabin with one of my best friends, Joel Brink. He's a radiologist. And I didn't have TikTok at the time, but his daughter, who was a teenager at the time, was like, hey, you guys have to do this TikTok dance. Well, me and Joel Brink, being good sports, were like, all right, we'll do it. So we did this TikTok. She had me create an account, and we muddled our way through this dance, which was, that video will never be seen by anybody ever again. But that's like how the TikTok account was created. Her name's Sydney Brink. So thank you, Sydney.
Yeah.
But anyways, I kind of posted a few videos, and a few of them kind of went viral, and it was like, oh, this is kind of interesting. People are interested to hear what I have to say. Mm-hmm. And so that slowly has built to over 100,000 followers, 18 million views in the last 12 months. And it's pretty incredible, but it's a really cool platform. You're not going to really see me doing dances and things like that, or the TikTok trends.
Well, we'll see.
Yeah, maybe for charity.
Right.
Maybe we could get Hans. Maybe for the foundation. He probably could talk me into something.
All right.
But what it's turned into essentially is hopefully kind of a shining light of encouragement on social media. Mm-hmm. People have struggles in their lives, and I think it's nice for people to talk about that, or how they got through that, or just being a real human, or having a real human story, I think really helps people, because I think people only see kind of the highlight reel. And, studies have shown that's not good for youth. And so I try to have my page be something that's just kind of a shining light of hope and love, and how to be loving to people. And that's important. And there's medicine mixed in there.
Right.
So if you follow me, you'll see a whole host of things. My siblings follow me. One time my older sister's like, man, I found out more about you on TikTok than you tell me, and so I don't know. I do like making TikToks. It's fun to do. It's a little side hobby. So,
well, I saw you out there on one of your tractors too, on one of it. I don't know. It looked like you were wearing fishing waders, but it was some sort of, did you have some sort of overall on while you were out there?
I love wearing my overalls. We have a family, a little piece of land owned by our family.
All right.
There's a pond on there and stuff. So there's nothing like clearing the mind by putting your overalls on and going out there and doing some work on the John Deere tractor.
Oh, well, I highly recommend people to follow you on there for sure. Because like you said, there's so much, and for me personally, it's just the misinformation that I can't stand. And so I like to follow the professionals that I can trust, right? Yep. Those to me are TikToks that we need way more. I mean, granted, I wouldn't mind seeing you dance to one of these viral ones for sure. But those are the TikToks we need, I think, more than anything. So I'm glad you're doing it. I'm glad you're having fun doing it.
Oh, it's fun. It's built really a beautiful community.
Good.
So it's
excellent.
Very nice.
Well, Dr. Huot, this is the second time you've been in. It's always great to have you come in and talk, especially
likewise.
because you bring coffee. So you will be booked a lot more, I'm assuming. But let's have you come back, and because you mentioned one specific, you were talking about epidurals, and as an anesthesiologist, it's something that you do.
Yes. Yep.
I want to have an entire episode about that, because I just learned that that's what anesthesiologists do. You do epidurals too.
Yep, we do
I
epidurals.
Had no idea.
It's one of the most. I think it's one of the most gratifying parts of my job.
Really?
You walk in and this laboring patient's kind of just miserable, and you walk out and they're smiling.
Even better.
And even one of the patients one time named her baby after one of my partners. That's never happened to me yet.
Oh.
But well, you can be that impactful.
Dr. Michael Huot, the Chief of Staff at Monument Health, and a doctor of anesthesiology there. Thank you for coming in again, Doctor.
Yeah,
I appreciate
it, man.
You bet.